Vitamin B12 deficiency is a type of megaloblastic anemia caused by impaired DNA synthesis in hematopoietic cells. The result, large, immature nucleated cells, megaloblasts that fail to divide properly and undergo apoptosis, leading to pancytopenia. There are several reasons why your body might not have enough vitamin B12. The most common, a pernicious anemia, an autoimmune condition that prevents B12 absorption. Strict vegan or vegetarian diet can also be a cause, especially without supplementation. Impaired absorption due to gastric surgery, gastritis, or diseases like IBD can prevent proper uptake. Certain drugs like metformin and proton pump inhibitors can also interfere with absorption. And there are also rare causes like fish tapeworms, which consume B12 directly. B12 deficiency affects both the blood and the nervous system. Symptoms of anemia include fatigue, irritability, and in severe cases, chest pain. And neurologically, you might see tingling in fingers and toes, or impaired memory and cognition due to demyelination of nerve cells. And jaundice can occur due to mild hemolysis. An inflamed tongue, or glossitis, is another hallmark. In infants, the signs can be subtle but serious, including developmental delay, tremors, and feeding difficulties. Diagnosis is based on blood tests and peripheral smears. Macrocytic hyperchromic anemia with high MCV and MCHC, low B12 levels, sometimes along with low folate, mild leukopenia and thrombocytopenia, and reticulocytopenia may also be present. In the peripheral smear, hypersegmented neutrophils are classic findings. In pernicious anemia, autoantibodies against intrinsic factor can confirm the diagnosis. A 54-year-old man comes in for his annual checkup. He mentions feeling increasingly fatigued over the past few months and notes a smooth, sore tongue that's been bothering him. He follows a strict vegan diet and had a bariatric surgery 3 years ago. On physical examination, there is a reduced vibration sense and proprioception in both feet. Routine labs reveal a macrocytic anemia with reticulocytopenia. A peripheral blood smear shows hypersegmented neutrophils. Treatment for vitamin B12 deficiency anemia is straightforward. Vitamin B12 supplementation, either oral or intramuscular, depending on severity and cause. Folic acid may be added if there is a combined deficiency. Encourage a B12-rich diet, including meat, dairy, and eggs, or fortified foods for vegetarians and vegans. In conclusion, vitamin B12 deficiency anemia is a common, reversible, and crucial to catch early, especially to prevent permanent nerve damage. Watch for neurological symptoms, check the smear for hypersegmented neutrophils, and always treat both the cause and the consequence. So, if you found this video helpful, give it a like, subscribe for more medical content, and see you next time.